All right, Renegades, I'm honored to have this opportunity to speak with you today. And I'm going to start off with this general idea that there are many different ways that people suffer. Especially at your age, some people suffer from a breakup or some family issues, or even maybe you lost a family member as well. But mental illness is another way that a lot of people struggle. And so our main focus for the presentation today will be to cover mental illness, but also to focus on mood disorders especially. So now we're going to transition to some facts. 25% of American adults suffer from mental illness according to the National Institute of Mental Health. So with that statistic, that means just in this room, 1 out of every 4 of you, on average, may suffer from a mental illness. Around 20% of the world's children and adolescents have a mental disorder or problem. Mental and substance use disorders are the leading cause of disability worldwide. About 800,000 people commit suicide every year. Stigma and discrimination against patients who suffer from mental illness and their families prevent people from seeking mental health care. Mental illness can affect persons of any age, race, religion, or income. Depression alone impacts more people than cancer, AIDS, and diabetes combined. There are various forms of common mental illnesses, including alcohol substance abuse, anxiety disorders, eating disorders, depression, ADD, OCD, as well as obsessive compulsive disorder, schizophrenia, and bipolar disorder. So now I'm going to share a little bit about my story. So let me teach everyone a simple lesson. People are afraid of what they don't understand. Because many people don't understand mental illness, they fear it, and they discriminate against people who may suffer from mental illness, and this discrimination prevents people from getting the help they need, from going to see a psychiatrist, going to therapy, or taking medication. We need to break the barrier of stigma, and that is why I want to share my story today. I suffer from bipolar I disorder. My doctors today think a head injury I had at the end of my 8th grade year triggered the dormant gene that runs in my family for this illness. The summer going into my freshman year of high school, so many unexpected changes started happening. I was more energized than ever. I didn't feel the need to sleep much, and I started to do uncharacteristic things that got me into trouble. Previously, I'd always been someone who had a good reputation, and parents were encouraged when their kids would hang out with me because they thought I was a good kid that did the right thing. But that summer, everything seemed to spiral out of control. I snuck out of my beach house at night, and I explored the beach and beyond. I broke curfew. I trespassed on people's property. I did all these really uncharacteristic things, and I didn't understand what was really happening. And then I said and did things that weren't like my normal self. And then I transitioned to my freshman year, Shawnee. And I walked into Shawnee High School like I owned the place from day one. I was so obnoxious, and I went around and I'd make disruptions in class and interrupt the teachers. And I'd go around to lunch tables and make lies just to get attention. I had all this erratic behavior, and I even failed my first assignments because I couldn't concentrate and study because I wasn't stable. And my parents, they were really concerned from all this erratic behavior, and so they took me to see a psychiatrist. It was then that I was diagnosed with bipolar I disorder. I was transferred to an emergency room, and then I ended up being in a psychiatric hospital for some safety and rehabilitation. It was then that I was put on medication, and I learned that that whole summer and the beginning of freshman year, I had experienced my manic stage. And it started to make sense that these uncharacteristic things were finally explained. When I came back to Shawnee, once I was on medication, I felt a lot more stable, and I was like that kid I was in 8th grade, a good guy with a good reputation. But my words and my actions, they came back to haunt me, and I was actually bullied for a fair amount of my freshman year because of my obnoxious first impression, which was really beyond my control because I was manic. Bipolar I disorder is characterized by 2 mood episodes. During a manic episode, my mood becomes escalated and my entire perspective changes. I feel like I'm on the top of the world. I sleep much less. My thoughts race at 1,000,000 miles in a minute, and I have these grandiose ideas. When I was in a manic episode over the summer, I got in trouble because my judgment, it was impaired. And the mania seemed to take control of my reasoning and morals. Now, there's another mood spectrum that people with bipolar disorder face, and that is major depressive episode. And during a major depressive episode, my entire world seems to change from color to black and white. I feel sad and empty. I lose interest and pleasure. My energy is gone. I can't concentrate. I feel vulnerable, and sometimes I even feel like I want to die. Now, Dr. Strauss will give us more medical details, and that will just happen in a little bit regarding bipolar disorder. So since freshman year, I've been able to get my life back on track for the most part, and I was stable for the majority of the end of freshman year up until my junior year of high school. I was able to make the mark on Shawnee High School that I wanted to make. I had the opportunity to be class of 2014 president, and I hosted my own show on Shawnee TV called The World Around Us. I started my own charity organization called Biehn Team, and I also launched the club Youth for Truth, which is a bipartisan political club for young Americans. But then at the end of my junior year, something went horribly wrong, and I, once again, didn't really understand why. All of a sudden, I just felt so terrible, and I had these suicidal thoughts that came out of nowhere. And I knew there was a really big problem, so I ended up driving myself to the emergency room, and I found out later that I had actually been toxic on one of my medications, lithium. And if I didn't go to the hospital, I could have died from lithium toxicity poisoning my bloodstream. My senior year at Shawnee was nothing short of a challenge. I was 0 for 60 in trying to find a medication combination that would keep me stable. Sometimes I felt suicidal. It was like my mind was waging a war against me. I felt like I missed out on a lot of my senior year. For example, I was the white team overall captain for Blue and White Night, but I wasn't able to even attend the event. I was voted homecoming king, but I was too depressed to go to my own dance. I got a lead in the musical Les Mis, and the musical is one of the things I was most looking forward to my senior year, but I ended up having to be hospitalized again, and I had to give up my role in the show. I was suicidal on Christmas Day, and I was going to a psychiatric ward on my birthday. I couldn't play tennis because I was so behind on my schoolwork. For prom weekend, I ended up having to be rushed to the hospital because of severe depression. And even for the senior trip to Disney, I had to fly home with Mr. Campbell because I really felt so uncontrollably depressed all of a sudden, and it just came on like a rush. Now, a lot of people, the reason why I'm telling you these things is because people with bipolar disorder and mental illness, sometimes they can't just suck it up or snap out of it. These are legitimate illnesses, and oftentimes it's beyond my control. And so many people would wonder, from an outside perspective, my senior year, everything looked like it was going so great. So people were wondering, why was I depressed? And depression was never a choice. It was just, something based on the deficiency in the brain's chemistry. And so I couldn't control my depression. It would just come on and overtake me, and I didn't have the power to stop it because it was a true mental serious illness. Now, the summer after my senior year at Shawnee, I went to one of the leading experts on bipolar disorder, and he told me I had one of the nastiest cases of the illness he's ever seen, and that he was happy I was still alive. So compared to most people who suffer from mental illness, I may have a more extreme case. Now, I ended up going to Ithaca College, got a nice scholarship there, and things weren't perfect. I ended up having to take 2 medical leaves of absences, so I had to take 2 semesters off due to intense depression. But this past semester, I was just in London, just got home, had a wonderful experience, and even though my health wasn't 100%, I was able to be the high-functioning person that I know I'm capable of being, and I was really able to make the most out of the experience. I have learned many techniques through therapy. I have focused on having a positive attitude, and I found hope in my faith, which has kept me from making the most out of every possible moment, for not every moment is possible to enjoy. Now let's just take a look at some bipolar disorder myths. Myth 1. People with bipolar disorder can't get better or lead a normal life. And that's just not true. The fact is, many people have bipolar disorder and they have successful careers, happy family lives, and satisfying relationships. Even though living with bipolar disorder is challenging, with treatment, healthy coping skills, and a solid support system, you can live fully while managing your symptoms. And even though I've had my fair share of challenges, I'm thankful that I've been able to achieve success in some areas, and I really attribute part of that to just such a wonderful support system that I have. Myth 2, people with bipolar disorder swing back and forth between mania and depression. The fact is, some people do alternate between mania and depression, but majority of people actually experience more depression than mania. And that's the case for me. My medication, for the most part, has controlled the mania, and I really haven't been hypomanic or manic in years. I just alternate between rapid cycling sometimes, between feeling normal, 100%, just like anyone else, to depressed, when it's like uncontrollably sad, and Myth 3, bipolar disorder only affects mood. The fact is, bipolar disorder affects so many things than just mood, including energy level, judgment, memory, concentration, appetite, sleep patterns, sex drive, and self-esteem. And even for me, bipolar disorder has other health effects on some people. For example, when I become depressed, I have these really painful migraines, and that's always linked to my depression. So bipolar disorder is a lot more than just mood. Myth 4, aside from taking medication, there is nothing you can do to control bipolar disorder. Now, medication, that's the foundation of treatment, but also therapy and self-help skills are also very important. And in addition, you can exercise regularly, get enough sleep, Eat right, monitor your mood, keep stress to a minimum, and surround yourself with supportive people. So I actually rate my mood every night to track my progress, and I try to exercise often and eat right and sleep well, because these are all things that help with achieving stability. Now, bipolar disorder, it's not a flaw in character, it's a flaw in the brain's chemistry, because there's a chemical imbalance of serotonin levels in your brain. And now, Dr. Alexander Strauss, he'll talk a little bit more about this.
Thank you, Chris, for inviting me out here and sharing your story. I think it's very powerful to hear from somebody who's gone through what you've gone through. So I'm Dr. Strauss. I'm a child-adolescent psychiatrist practicing in Marlton, New Jersey. And what I want to do today is talk about what a child and adolescent psychiatrist is, why adolescents or parents might seek someone like myself out. We're going to get into a little bit more of the specifics regarding bipolar disorder, and then later on we'll have time for questions. So a child psychiatrist is a physician specializing in the diagnosis and treatment of things that involve thinking, feeling, behaviors, generally affecting children, adolescents, and families. In order to get here, I graduated from high school. I recommend you all do the same. And then went on to college for 4 years, went to medical school for another 4 years, and then trained for 5 additional years in adult psychiatry, and then child-adolescent psychiatry. Then I got to start a job. So why are people coming out to see a child and adolescent psychiatrist? So oftentimes, parents will come to me saying their kids have had a major drop in their grades. Kids may say they're having struggles coping with typical problems, typical things that happen in their daily lives. There might be changes in their sleep, in their eating. Oftentimes, kids are visiting the school nurse often, having a lot of physical complaints, headaches, stomach aches. There might be sexually acting out, depression with prolonged negative mood like Chris described. Substance use is another big thing in high school. Fears with regard to body size and eating, nightmares. Also, we see self-injury, threats to harm oneself, thoughts about harming oneself. Outbursts and anger definitely get parents riled up and want them to come see me. Threats about running away or actually running away. Being aggressive towards people or property, and having strange thoughts, beliefs, feelings, seeing things, hearing things out of the ordinary. What I want to do today is also kind of talk a little bit about bipolar disorder from a medical perspective. Chris described having type 1, which includes having a manic episode with or without a major depressive episode. There's also bipolar 2, which is a hypomanic episode, which is kind of less impairing, less high than the manic episode with the or without the depressive episode. And then there's other variants of bipolar disorder which kind of have features of these things but aren't as strict to the criteria. People ask, why did I get bipolar disorder or what caused it? There is no single gene or single cause, and several factors can be involved in this. As Chris indicated, he said that he had his head hit. I happen to specialize in post-concussion and traumatic brain injury. There are studies that show that a small, tiny percentage of people who hit their head have an increased risk of bipolar disorder. We also know that there's an increased risk in people who have family members, as Chris mentioned. There's also things like triggers. Anxiety, depression, things along those lines can be triggered by stressful events. And I would imagine as high school students, you guys have experienced some stressful events in your lives and will continue to do so. So when we look at first-degree relatives, so that's like a mom, a dad, brother, sister, there's about a 7 times higher likelihood of developing bipolar disorder than in the general population. So most children with family history of bipolar disorder will not develop the illness. About 90% of those with bipolar disorder, however, do have a first-degree relative with a mood disorder. And mood disorders are bipolar disorder or depressive disorder. Most cases are going to start between the ages of 15 and 19. And so maybe Chris was slightly on the younger side when this began, but the high school age range right into the beginning of college is when these illnesses start to develop. And at least half of all cases are going to develop by 25. Now, the lifetime risk is about 1 in 100, about 1%, and males and females are equally affected. 90% who have one episode of a manic episode are going to have a second episode, which could be manic or could be depressive. Also, 60% of the first episodes are going to be triggered by something. Somebody might use drugs, get into a breakup, fail a class, but then as time goes on, those episodes don't necessarily need any triggers or stressors. They just come out of the blue. When we talk about being manic, and I think that the phrase is sometimes just thrown around, oh, he's being manic or she's being manic. In the medical criteria, we're talking about 7 days of this, most of the time during the day, or somebody needing to be hospitalized, where they have 3 or 4 of the following symptoms. So we're talking about an inflated self-esteem or grandiosity. Chris talked about feeling like he owned the place. A decreased need for sleep. So this is not that you're not sleeping because you're on your phone or texting or chatting or playing video games. It's that you feel like you don't need to sleep and you still have high levels of energy. You might be talking a lot faster than you normally talk. Have ideas racing through your head, so it's hard to focus on any one thought. The ideas just keep coming. You can be distractible, be agitated, or do goal-directed things. So you might get into writing, or you might get into cleaning, or you might do other types of things that you don't typically do at that type of level. Homework, for instance. And then there's also excessive involvement in risky activity. So that might be breaking onto other people's property, as Chris mentioned, drug use, sexual activity, things that you typically wouldn't do. And now that's a manic episode. To have a hypomanic episode, you have to have similar symptoms for less period of time with less impairment. So you might just be more productive. Some of the top CEOs in the country are probably bipolar 2 or hypomanic, where they can just not need a lot of sleep, get a lot of stuff done, and it doesn't impact them significantly. Now, depression isn't just, I'm depressed because my girlfriend broke up with me, or I'm sad. Depression is a clinical illness that causes functional impairment lasting at least 2 weeks. So we're talking about 14 plus days of generally feeling down and depressed, having lack of interest in doing things, changes in weight. You might be eating more or eating less. You might be sleeping more or sleeping less, but generally you're not feeling very energetic, very different from the manic period. You can be agitated or just slow down and not really doing much at all. Fatigue and loss of energy, feeling worthlessness or guilty about things that you've done or things that you might do. Your grades might drop because you're not able to focus on the teachers and the classes and study. And then there's the risk and thoughts about death and suicide, wishing you were dead or wanting to kill yourself. So one of the things that I really try to do in my practice is work with kids, adolescents, families, and their schools on how do we best manage this. How do we allow you to continue doing the majority of the things that you're doing while you're going through an episode like this? Because it can be extremely challenging to do everything that you're involved in, your clubs or sports, your school activities, your socializing. And what I know is that it's really important that they don't take away sports and clubs and friends while you're trying to get back. But also, you can't necessarily do everything that you were able to do when you're in a euthymic or normal mood state. And so what can be really important is working with families and schools to try to figure out a game plan, not only to treat what's going on, but also to help the schools and students get through these times. I also want to mention that it's really important, if people are suffering, you, yourself, your friends, your family, that there are ways to get help. You can seek out a friend or a family member. Call a doctor or mental health provider. Go to the hospital. Chris drove himself there, fortunately, when he was lithium toxic. Call 911. They will send somebody out. There's a national suicide prevention hotline that's available 24/7. If you Google suicide, that's what comes up. Talk to a trained counselor. I know that they have them here at the school. If you're in crisis, make sure that you're not left alone. And if a friend is in crisis, make sure that somebody can be there for them. Thank you guys for having me, and here's Chris.
Thank you, Dr. Strauss. So we're going to continue on that theme, how you can personally help. So there's a quote by Plato, "Be kind, for everyone you meet is fighting a hard battle." So one of the major things you can do is first, recognize the symptoms. Second, convince the person to get treatment. So if they're not willing, maybe encourage them to go see a psychiatrist, go see a therapist, maybe even to take medication for their illness, because oftentimes it can be necessary. 3, tell the person that he or she is loved, deserves to feel better, and will feel better with appropriate treatment. 4, if the person is not functioning, accompany him or her to treatment until normal functioning returns. 5, if the person is suicidal or having hallucinations or delusions, arrange for a hospitalization. If the person is functional and refuses treatment, seek the assistance of others. Ask a friend, ask a doctor, ask a clergy member, ask a relative, and allow these people to help convince him or her that treatment is needed and will help. And I'm very fortunate that my close friends have been extraordinarily supportive. My family has been extraordinarily supportive. And I encourage you to be extraordinarily supportive for someone you know who is facing mental health challenges. There's no shame at all in seeing a psychiatrist. There's no shame at all in going to therapy. And there's no shame at all in taking medication. And oftentimes for a lot of people, going and taking these steps can really help them live a happier, healthier, stable life. Let's look at some don'ts versus do's when you're trying to help someone out. So don't say things like be strong, don't cry, focus on the positives, man up, be grateful for what you have, especially when someone's going through something like depression. Oftentimes, they can't see those pieces of advice helping them out. Don't be afraid to ask the person if she is suicidal. That's a very important part of information to know. Don't joke about suicide. I hear this all the time. People will say things like, you're so ugly, you should kill yourself, or, I just failed a test, I'm going to kill myself. And really, that's not the most respectful language to speak about, especially for someone who has had suicidal thoughts. Don't minimize what they're going through. Tell them there are starving children in Africa, or tell them you know exactly how they feel. Each individual goes through mental health challenges differently. So saying you know exactly how they feel is probably not accurate. You can say, I want to help you through it, but you might not exactly understand where that person's coming from. Now, some things you can do listen without judgment, do express sympathy, encouragement, and support, do help the person find resources, that's such an important part, and do know your role and have realistic expectations for how you can help. The most meaningful connections are made when you're vulnerable. Find friends and family that you can openly express your vulnerabilities, and be someone that other people can open up to you. Everyone faces adversity in life, but how we deal with adversity defines us as people. A friend of mine made me believe in silver linings. Oftentimes, I'm an optimistic guy, but when I experience a lot of depression, sometimes it's hard to see the glass half full. But no matter what the circumstance is, always look for silver linings because they're there, even if they're hidden. Hope is one of the most transformative powers. And if you lose hope, ask people you love to help you show you what you have to be hopeful for. Now, whether it is with mental illness or really anything, you never know exactly what's going on in someone else's head. So be mindful of perspective and just be open that you might not exactly understand what they're going through, but you'll be there to help. And love is the most transformative force in the cosmos. Make sure you're there for friends and family who need you. And just, sometimes something as simple as, a hi or a smile could be a wonderful sign of love for someone who's struggling. So you never know what a random act of kindness can do to someone if they're experiencing some challenges. Now, some of those brilliant, creative, and historically important people suffered from a mental illness. Here are some famous historical figures that were mentally ill in their time. Abraham Lincoln, Sir Isaac Newton, Winston Churchill, Vincent van Gogh, and Ludwig van Beethoven. And even some more modern-day examples, Demi Lovato and Robin Williams are also two people that have been affected by mental illness. Now, these people, they weren't defined by their health challenges, and actually they achieved greatness. And I think sometimes mental illness can help with creativity and can help you become successful. So those people were not limited by their challenges.
Listen, learn, accept.